The Senate has delayed a vote on the Republican bill to replace Obamacare. Senator John McCain is recovering from surgery to remove a blood clot above his left eye. His absence means the Republicans don't have enough votes to start debate. GOP Senators Susan Collins and Rand Paul each say that they oppose the bill, and about a dozen others have expressed concerns. Here's what Senators Collins and Paul had to say in interviews yesterday.
You know, I think the longer the bill's out there, the more conservative Republicans are going to discover that it's not repeal, and the more that everybody's going to discover that it keeps the fundamental flaw of Obamacare. It keeps the insurance mandates that cause the prices to rise, which chase young, healthy people out of the marketplace. So for all Republicans' complaints about the death spiral of Obamacare, they don't fix it. They simply subsidize it with taxpayer monies, which I just don't agree with at all.
There are about 8 to 10 Republican senators who have serious concerns about this bill. And so at the end of the day, I don't know whether it will pass, but I do know this. We should not be making fundamental changes in a vital safety net program that's been on the books for 50 years, the Medicaid program, without having a single hearing to evaluate what the consequences are going to be.
Okay, so let us bring in Zeke Miller. He's a CBSN political contributor and a White House correspondent for Time. Thanks for joining us, Zeke. Of course, we are going to start with health care. And we've got about a dozen Republicans who are expressing concerns about this Senate bill. We have 2 Republicans right there who say they're going to vote no for sure. And now we have this delay because of Senator McCain's surgery. What sort of impact do you think a shift in the timeline to get this debate started and then ultimately voted on, what sort of impact do you think it's going to have?
You know, this is the sort of legislation that the more people have time to sort of ruminate over it and look at the fine print there, and you know, it's not going to get any easier for Republicans to vote for it. The Democrats, independents, sort of opponents of this legislation, even in the conservative side, they're getting more and more organized as time goes on. There really is no organized effort within the Republican Party or the conservative movement generally in favor of this bill. There's some threats from the White House, so it's going to get harder and harder. This delay due to Senator McCain's health issue is only going to make it worse. But at the same time, you know, it doesn't really affect the fundamentals, which is that you know, the votes aren't there yet. You know, whether the vote was going to take place this week or next week or the week after that, whenever Senator McCain does get back, Mitch McConnell still doesn't have those votes. So the timing, you know, it's going to be harder. It grows more unlikely the longer this drags out. But it was very unlikely to begin with. Yeah,
and the other thing we heard is that the CBO score is not going to be available anytime soon as well. That's got to delay things as well.
Yeah, certainly, and that's the sort of thing that a lot of Republicans want to see. They want to see what the independent CBO views the impact of this legislation and sort of the tweaks that have been made to try to win over particularly conservative members of the Senate Republican caucus. They want to see what those impacts are going to have on their constituents and the members of their states, the national health care system more broadly. So once that does come out, and it will come out, in particular because of this delay, it's not going to be really much easier, most likely at least for a lot of these Republicans to get on board.
Right. And meanwhile, the president tweeted over the weekend that he's waiting, pen in hand, ready to sign something that they put in front of him. I'm wondering, what are your sources telling you about the role that the president is playing in this process? Certainly publicly, he doesn't seem as involved as he was during the House bill when they were trying to get the House bill passed. But that's publicly. What do you know?
Yeah, I mean, what we've seen publicly is a lot of what's happened privately as well. The president hasn't been as engaged in behind-the-scenes meetings. He hasn't really been working the phones to sort of swing Republican senators, in part because he doesn't have a lot of sway over them. You know, the Senate's very different than the House. The House Republicans are up every 2 years. The Senate's up, you know, every 6 on those staggered terms. So there aren't a lot of sort of screws the president can twist. And he was told by Mitch McConnell that in some cases his intervention would be counterproductive. So the president is sort of taking a little bit of a step back. And from the White House perspective as well, they don't want to put the president front and center on legislation that, you know, is unlikely to pass. In the House, you know, Republicans had a comfortable margin. That was a very tight margin for them ultimately on that legislation. The Senate, you know, it's even tighter. It's a lot harder for them. It's, you know, the odds are a lot slimmer in a way that they don't want to put the president out and make him seem vulnerable, because if it doesn't pass, then the president would end up looking weak. So they're trying to keep him in reserve here.
Right. So meanwhile, in the background, or perhaps in the foreground, is this whole issue of Donald Trump Jr., his meeting with a Russian attorney, and what that all meant in terms of the greater investigation. The president's attorney, Jay Sekulow, was on Face the Nation, and he commented on this situation. Let's listen to that, then we'll talk on the other side.
Position research in campaigns happens all the time. It was in the middle of a campaign. And again, I'm not their lawyer. I was not the campaign lawyer. I'm not the campaign lawyer. I represent the president. I need to be clear on this. The president's engagement on this was that he was not aware and did not participate in any of this.
Okay, so in another interview, Zeke, over the weekend, Mr. Sekulow wondered why the Secret Service would even allow people in Trump Tower if they had sort of nefarious motives. The Secret Service kind of pushed back on that narrative. But what do you make of this evolving line of defense now?
It really is just, drip, drip, drip here that, that we found out on Friday that there were other people in this meeting, identified them as this, this sort of shady Russian lawyer, sort of Russian intelligence official. There's just, there's a lot, progressing here that the White House, the Trump campaign, Donald Trump Jr. have not gotten in front of it, sort of violating every rule of crisis communications, which is, get it out yourself, get it out quickly, and get it all out so that it doesn't keep coming back. And that's sort of, they're taking the opposite approach, letting it drip out slowly, letting others do the work for them, and sort of get in a scoop every time it comes out. And then it's really puzzling why they would take this tack. But it is what was notable in Jay Sekulow's answer just there that you showed is that he's saying the president didn't know, not that others in the campaign, not even that the president's son didn't know. So obviously he's protecting his own client there, but that is a sort of an interesting bit of legal jujitsu here that is certainly the sort of thing that Robert Mueller is going to sort of, that's going to, pique his interest and sort of, give him more to look into.
Right, exactly. And by the way, the Secret Service said that at the time, only Donald Trump was under Secret Service protection, so they would not have been taking an interest in who his son or other people would be meeting. Before I let you go, new poll numbers came out showing the president's approval rating at 36%. That is the lowest in 70 years for a president after 6 months. The president sort of brushed it off on Twitter. But let me ask you this. It doesn't look good, certainly, but let me sort of supply you with an alternate argument. Look, we still have a bit of time before the midterm elections. We still have a lot of time before the next election. He's only 6 months in. Maybe these numbers don't mean much.
That's certainly possible. There's an opportunity. Presidents always take a little bit of time to find their sea legs. What is the challenge for the president right now is that he's in that position, that 36%, and healthcare doesn't seem to be going anywhere fast. Tax reform may or may not happen. He's losing political capital. There aren't a lot of easy opportunities for him to sort of claim, an easy win to sort of bring those numbers back up to the area where, re-election is a lot easier, that he doesn't become a drag on his party next November. Even if Republicans did turn around and pass health care, that legislation itself is so deeply unpopular that, yes, the president would have a win for the base. That's not really going to raise his poll numbers much higher anyway. So the president has this is a problem for the president now. It can be a problem for him in November 2018 and certainly November 2020 if he doesn't take steps to turn it around. But it's not really clear what those steps are. This Russia thing is a drag on them. He needs to find a way to move past that and also do other things. I mean, this is a very turbulent position troublesome position for the president right now. So it's unclear how he gets out of it.
All right. Zeke Miller of Time, thank you so much, Zeke.
Thank you.